Thanks to the hard-working combined team from various government ministries, agencies and individuals, as well as the private sector, it's good to know that the fire at the Riverton City disposal site is under control. But that's not all that kept the government busy this week. We'll tell you more later in the show. Hello, I'm Adrian Atkinson and you're watching Jamaica Magazine. All eyes are still on the nation's fiscal plans for 2015-2016, and today we are putting the spotlight on some key projects that have been budgeted to maintain and enhance justice delivery. Also, equipment that helps to monitor air and water quality. So, stay with us.
Persons with chronic respiratory illnesses such as asthma or recent respiratory infections should not participate in outdoor activities in areas affected by smoke and other emissions. A message from the Ministry of Health.
Good day, I'm Andrea Chizom and this is your JIS News for Thursday, March 19. The authorities have acquired additional resources to aid in the cooling down operations at the Riverton disposal site and continue to cover the burnt areas on Thursday to further minimize the spread of smog from the fire. The Office of Disaster Preparedness and Emergency Management (ODPEM) says up to Wednesday, approximately 60% of the burnt area was covered. But as these operations continue, ODPEM says the surrounding communities may continue to experience some smoke cover. Persons are urged to take the necessary precautions to safeguard good health and safety. All health centers in Kingston, St. Andrew and St. Catherine continue to provide extended services to residents in and around the affected communities. School administrators and businesses are also still being advised to exercise discretion. Meanwhile, the board of the National Solid Waste Management Authority says new plans to improve the management of Riverton and other disposal sites will be communicated as soon as they are finalized. In a statement released Wednesday, the NSWMA board said the long-term management of the disposal sites was being actively reviewed. The board said further that the authority would soon be advertising for a new executive director as Jennifer Edwards' contract expires on March 26, having been extended from February 24 of this year. Deputy Chairman of the Board, Maureen Seymour, will oversee the day-to-day operations of the Solid Waste Agency and its regional offices until a new executive director is appointed. In the meantime, the NSWMA Board apologized to the nation for the inconvenience of this latest fire and said its teams and their firefighting partners were working around the clock to fully extinguish the fire and clear the smoke nuisance. The replacement of 8 kilometers of pipeline in Clarkstown, Trelawney has improved the water supply to customers served by the National Water Commission. Approximately 6,700 persons in the communities of Clarkstown, Georgia, Spicy Hill and Silver Sands are benefiting from the project, which was completed at a cost of nearly $91 million. At the recent commissioning ceremony, Water Minister Robert Pickersgill said potable water had a tremendous impact on sustainable development and the provision was a high priority of the government.
This administration realizes that water is a very empowering resource and that its impact on sustainable development, particularly in our rural communities, is without parallel. And so we are working hard to ensure that our rural communities receive a steady supply of this precious resource.
The minister pointed out that the pipeline replacement project formed part of efforts to reduce the NWC's financial losses as several leaks were discovered on the old pipeline. Cocoa farmers recently received much-needed equipment to carry on production. 5 rototillers, 4 water pumps, 40 rakes and hand forks were handed over to the Jamaica Cocoa Farmers Association JCFA by Food for the Poor. JCFA board member Michael Leckie said the donation supported work to improve production in cocoa-producing parishes.
Our extension services in the 5 parishes, we have rehabilitated 370 acres of cocoa farms. We have trained 139 farmers in entrepreneurship and 130 farmers in post-handling and processing of cocoa.
Cocoa production at the end of 2014 stood at 750 tons. Food for the Poor asserted that the cocoa industry was a viable one and they said it was looking at other partnerships to help resuscitate production. The St. Catherine North Police Division is now better able to address an upsurge of crime in their area with the opening of the Fellowship Hall Police Post in Hill Run, St. Catherine. The facility, which was officially opened by National Security Minister Peter Bunting on Wednesday, was sponsored by the Caribbean Brawlers Group in partnership with a number of other private sector companies. Minister Bunting said it fit in well with the proximity policing efforts of the Jamaica Constabulary Force.
It has had a very positive effect in terms of reducing crime, but perhaps more important in a way, it has allowed the community to develop relationships of trust with the police officers who are right there, same cop, same beat every day, and they get to know the community and the community gets to know them.
The police post will also be assigned a vehicle to assist the officers execute their duties. The Fellowship Hall Police Post also boasts cutting-edge security and communications capabilities. And finally, another initiative to incorporate greater use of technology in education has been launched and welcomed by the Education Ministry. The My Locker e-learning platform was developed by 1&1 Educational Services Limited. It will allow students to take all their high school courses on mobile phones, tablets, personal computers, laptops, and even their television sets. The initiative has been hailed by Education Minister Reverend Ronald Thwaites, who declared it as another step in revolutionizing the country's education sector through technology.
It is very important that learning aids such as this, which will now revolutionize the classroom by placing before every Jamaican who has access to online learning the option of the best teachers to supplement, not supplant, to supplement, not supplant, the instruction that they get in the school will be of inestimable benefit.
The platform comes equipped with a suite of integrated functionalities that will give the user the complete learning experience. And that's it for JIS News today. I'm Andrea Chisholm. Thank you for watching.
Man, Sam. Alright,
what want, cat?
You don't know, I sit downtown the other day there.
Oh.
All the brethren, them man, we buy and sell marina. One of them I sell a 6-pack for $1,000 and the next one I sell one for $200.
So where buy?
Buy 5 of them for $1,000. Think them can't rob me.
So Uncle Fancy is the same $1,000 you would spend to get the 6? Seriously?
Tell them again now, my math brains.
Math count.
Math count.
Sponsored by the Ministry of Education.
Enabling a just society is a critical priority of the government. And so this fiscal year, the Ministry of Justice will continue to carry out and implement measures to facilitate this. Money has been set aside in the national budget to achieve the ministry's plans. Stacey Smith tells us more.
Last year was a busy legislative year, and 2015-2016 promises to be as active as the government seeks to improve the justice system to protect all Jamaicans.
With over $6.7 billion set aside in the 2015-2016 estimates of expenditure, the Justice Ministry will improve court infrastructure, train the administrators of justice and more to broaden and enhance the justice system during the fiscal year. Of the approximately $6 billion budgeted for the Justice Ministry's housekeeping expenses in 2015-2016, $1.26 billion will go directly to the ministry's main management functions. It includes $44.3 million for the Justice Training Institute to train the ministry's legal and non-legal staff. Other notable allocations include $211.7 million to implement the National Plan of Action Against Human Trafficking, as well as to continue corruption prevention and victim services programs. $401 million is also budgeted for legal services under various divisions. The remaining $4.8 billion in the ministry's recurrent budget is shared among its various departments. They include the court divisions, Director of Public Prosecutions, Attorney General, Administrator General, Parliamentary Council, Legal Reform Department, and the Court Management Services. In the 2015-2016 fiscal year, government has also budgeted $122 million to fund two key projects. $72 million is to continue work under the $1.49 billion project to provide court facilities. This money should complete all works on Public Buildings North and begin refurbishing Public Building East. Meanwhile, $50 million is set aside to continue the $1.32 billion project to refurbish the Hagley Park Road complex. Several multilateral and bilateral agencies are also supporting justice delivery in Jamaica in fiscal year 2015-16. With a total allocation of $589.5 million. The Canadian International Development Agency will provide $203 million for the Justice Undertaking for Social Transformation project. It will cover reform of the Supreme and RM courts, as well as courts management and administration, among other areas. Meanwhile, support for the Independent Commission of Investigations will continue under the JCF Accountability Programme. The UK Department for International Development's allocation this year will enhance INDICOM's investigative and forensic capacities. The European Union will continue to fund the 5-year Justice, Security, Accountability and Transparency project. The 2015-2016 allocation will buy new equipment for INDICOM and provide financial support for the agency's legal staff and public relations strategy. It will also allow the Justice Ministry to begin installing court management system technology in select courts and to renovate and equip some courts with audiovisual technology. And the Citizen Security and Justice Program, CSJP3, will get $145 million in funding from 3 multilateral partners. That money will provide victim support and legal aid services, as well as capacity building in mediation services, support restorative justice, and conduct training in child diversion processes. Much will be done in the 2015-2016 fiscal year to enhance justice delivery for all Jamaicans. It's a Government of Jamaica strategic priority, and resources have been set aside to get the job done.
Pay special attention to children, especially those who are asthmatic and/or suffer from other respiratory illnesses. Seek medical attention immediately if breathing is unusual. A message from the Ministry of Health.
With the recent smoke pollution from the Riverton City disposal site in Kingston, the Ministry of Health placed monitors at different locations across the corporate area to carry out an assessment of the air quality.
And the preliminary tests have resulted in results which have shown that for the site, one of the sites on Spanish Town Road close to the fire, the level of particulate matter, those are the fine particles that you'll find in any smoke of this sort, was just above the normal limit. The site in Halfway Tree was well below the normal level. We still await results of other tests for volatile organic compounds, and these tests are conducted overseas, and we will have these before the end of the week.
In our next feature, we highlight some of those equipment that let you know when you are exposed to above normal pollutants.
The thick, black, acrid smoke rising from the tail end in front of you. The cloud of dust shooting up from the construction site across the road. The unseen particles in the air. Environmental pollutants that can lead to serious health problems. Over the years, a whole host of measures have been employed to reduce the risks, but still we are not out of the woods. But increasingly, technology is being applied to the problem, and the developments are encouraging.
People who are exposed to pollutants in the environment can have different types of reactions, depending on the level of exposure, like the time and duration.
So the effects of pollutants have prompted the government to draft new public health regulations. One particular piece of legislation targeting cigarette smoke represents a major step forward in discouraging smoking in public places.
We must bear in mind that every health impact has a cost related. For some of them, studies will have to be done to determine the exact cost on each health outcome.
At Green Expo 2011, where the focus was on environmental protection and preservation, firms displayed the latest technology to help clear the air, literally. Air quality is important, and in an office setting where most of us spend the majority of our day, testing for balance in temperature and humidity is key. Emphasis should also be placed on detecting bacteria or fungi in the air that may lead to ailments.
The meter is able to analyze and log temperature, carbon dioxide, relative humidity, dew point, and carbon monoxide, all in real time. If the temperature is too high, people complain. If the temperature is too low, people complain. If humidity is too high, people tend to feel clammy, and so this can affect workers' performance in the office.
An acceptable indoor office temperature is anywhere from 22.8 degrees Celsius to 26.1 degrees Celsius, while relative humidity should be between 30 and 60%. The risk of carbon monoxide poisoning is a critical reason for the importance of air quality testing, especially in factories or power plants that give off fumes or smoke. Dry periods, construction sites, and newly built housing schemes all have one thing in common. They expose us to unwanted dust. Long-term or overexposure can lead to serious risks such as asthmatic conditions and damage to the lungs. And though the naked eye can't see the magnitude of our contact, dust meters are able to capture that information.
This machine in particular examines dust particles of 10 micrometers or less. A micrometer is 1/1000th of a millimeter, and at that size, particles are able to bypass the nose hairs and get into your lungs, which can cause long-term respiratory ailments. And data from this machine is particularly useful because it is a US EPA referenced standard, so data from it can actually hold up in a court of law. How the ambient air sampler works is that there's a vacuum down here which sucks in air through these pores, and it is placed onto a filter, and we weigh this filter before use and after use and do a calculation based on a time-weighted average, which gives us a dust reading in milligrams per meter cubed. The more data we collect and the more accurate this data allows us to monitor our environment better and mitigate against negative environmental impacts.
We use technology to quicken in terms of our studies. Also, we find that employing technology improves our quality of work that we produce.
To mitigate against these exposures, people can wear protective gear where it is necessary. In our own homes and offices, we can mitigate against the amount of dust that would accumulate by having regular cleaning.
The greatest thing is to know. Being aware of what's in your air could save your lungs and keep you healthy. Stop! Think before you burn.
Information to safeguard your health continues to flow on today's program. This time, the serious issue of colon cancer is what every man and even women need to know.
Colon cancer is cancer of the large bowel. The large bowel is that area of the bowel which contains the waste products. Whenever you have colon cancer, it means that those cells are growing uncontrollably, and it's something that is very serious. It is a condition which we have to diagnose early, and so we can manage it appropriately. Once we diagnose colon cancer, the next step is to stage it. We want to know if it's confined to the colon or if it's outside the colon. So you're likely to have a CAT scan of the abdomen, a special X-ray, an X-ray of the chest, and some blood tests. We can use that information to decide if it's localized or if it's very involved. And that can help us to plan what your treatment is going to be. Colon cancer, it affects males and females equally. The usual age group that's at risk is age 60 and over. You can find colon cancer in the younger individuals, however, usually if there's a risk factor, and that's normally family related. Colon cancer is caused by genetic factors, so it can be passed from your parents, grandparents down the line. There are also lifestyle changes which can increase your risk for colon cancer. And these lifestyle changes can be diet related. So if your diet is not very good, if you have a lot of fat in the diet, or if you have a very low fiber diet, not enough roughage in the diet, that increases your risk for colon cancer. If you smoke or if you consume excess alcohol, that also increases your risk for colon cancer. There are some medical conditions which can also increase the risk. If you have a history of polyps, which are like little growths in the bowel, that can also increase your risk for colon cancer. If you have a condition known as inflammatory bowel disease or ulcerative colitis, that can also increase the risk. So those are the usual risk factors for colon cancer. Colon cancer is very common in Jamaica in terms of cancers. We do know that it's the third most common cause of cancer-related death. So in males behind lung and prostate, in females behind breast and cervix. It accounts for maybe between 13 to 18 new cases per 100,000 per year in Kingston, and it may be even higher if you consider the entire island. The prognosis for colon cancer is very good, even though the numbers are very high, but the prognosis is good if you pick up the disease very early. So the earlier you detect colon cancer is the more likely you are to survive the condition. And that's why screening is important. Screening has been shown to reduce the incidence of death and complications from colon cancer. And we can use screening to actually prevent the development of cancer and treat. Stage 4 disease, however, if it's very late and has spread outside, only very low survival figures, as low as 20% would still be surviving by 5 years. So you do really need to pick up the condition very early, and that would be the best chance to improve your survival. The important thing about colon cancer is not to wait for the symptoms to appear before you consider the diagnosis. If you have any symptoms at all, they may be subtle at first. You may notice only a change in the bowel habit. So if you're used to going out just once a day, for argument's sake, you may find you're going now every 3 days or every other day, or even going more frequently. So it could be either going less frequently, having constipation, or going more frequently, diarrhea. You might see mucus in the stool. You could see blood in the stool as well. Or you could have signs that the cancer is more advanced, so weight loss or pain in the abdomen, recurrent vomiting, or jaundice if it spread to other organs.
Join the fight. Quit smoking for life.
Eat right, enough exercise, and get enough rest.
Try to eat properly, which is kind of hard to do because of monetary problems. But yeah, and try to get as much rest as possible.
I normally exercise and eat properly, like a lot of fruits, vegetable, drinks a lot of water.
Eat healthy, exercise, maintain a proper hygiene, and maintain a balanced diet also.
I play football here at school on Friday evenings. I also jog around my community, and I ensure that I maintain a healthy diet.
Well, I try to eat right as possible, stay away from the fried stuff, and eat up my vegetables.
I eat a lot of vegetables, all the 6 food groups, and I eat a lot of legumes, a lot of fruits. I exercise, I walk every morning, every evening, and I just keep fit.
Exercise and keeping a positive frame of mind.
I eat right, practice good hygiene, as my mom always say, bathe every day and thing.
So time is money.
Easy driver. Well, no minimum man and taxi driver drive so bad.
Why him have to drive so hard? Me not gonna make you kill off me and me picnic them.
One stop driver. Make her come off this bus. Me say stop.
Me coming with you. The rest will not take chance in the life. Lord of mercy. That could have been us.
And look how we want the money.
Passengers, your safety is in your hands. Say one-stop driver and get off if the driver is speeding, overtaking recklessly, and not obeying the rules of the road. Don't give away your life. It is too precious.
This is where we say so long, but please, join us again tomorrow, same time, same station, for another insightful program. Until then, keep the link via our website, jis.gov.jm. We welcome your feedback, so keep sending your comments to Jamaica Magazine at jis.gov.jm or via tweet at JIS News. On behalf of the entire production team, I'm Adrian Atkinson. Have yourselves a pleasant evening.
This has been a production of the Jamaica Information Service, the voice of Jamaica.